Hey docs, hope you're doing well. This is in regards to the bone grafting course, October 14th at 6:30 p.m., 6:30 to 8 p.m. So a nice quick hands-on bone grafting course. As we know, first I want to say to everybody, congratulations. You're doing a lot of extractions. I think extractions are super important in growing your practice. When people want teeth out, they want it now. So you're providing a great service for your patients. What we've heard from a lot of doctors, which I myself am saying the same thing, when you do extract a tooth, I mean, the reimbursement isn't the best on there. So then what can you do that's better for the patient and better for yourself? It's okay to say better for your pocketbook, right? So better for yourself, but also really better for the patient, and that is bone grafting. Bone grafting is a standard of care. Bone grafting, if you are not talking to patients about it and they come back and say, hey, I want an implant, or I don't like this dent in my jawbone, or I don't like that my other teeth are losing bone, you better have some really good notes on there. But what's better than just relying on good notes is actually doing the procedure and getting acceptance. How can you find that out? The standard of care scorecard. Please look that up. It tells you exactly where your percentages are. I'm sending out an email to you in regards to what we're saying if you're in a certain area. If you're 0% to 49% in bone grafting, we're asking you to come to this course. If you can't make this course, we're gonna have another course. We need you to come to some course because we want to support you again in your license and protecting your license, but also want to support you in the growth of your office and doing some really cool things. We also want to help your team leaders and BAs learn how to do a financial presentation so your acceptance goes up, right? If you're 50% to 70%, you're probably doing a lot of bone grafts. You know how to do bone grafts. Dr. Schmidt's going to teach you how to do a lateral bone graft, which is awesome. But we're also going to train your team leaders and BAs to get from 50% to 80% or 70%. We have 2 offices that are doing 100% in bone grafting. If you're above 70%, you're doing awesome. I encourage you to go to both courses because you can always learn some nuggets and constantly learning on there. But congratulations on that. You're doing a tremendous job. D1 as a whole, we're about 25% in bone grafting. So we have some work to do. Again, bone grafting is the best for our patients. It is moved to the standard of care. We have to make sure that we are documenting it and putting it in there. The answer is not to just stop doing extractions. I heard that too. Well, I'm not going to do bone grafts, so I'm going to stop doing extractions. Extractions are needed to build your practice. Again, it is one of those services that patients want. So I appreciate it, docs. Please look at that email. Please talk with your team leaders and BAs. We want to support you more. We want to support you on both ends, both the clinical side and the financial and treatment presentation side. So thank you again. Appreciate it.